Hey, welcome back, everybody. Guess what? We got to talk about this sensitive topic. Do you recognize this guy yet? You should. We have him on like every couple of weeks or so. This is Andrew Reinhardt from Wasatch Medical Clinic, and when he's on, we talk about the sensitive topic, the awkward topic, erectile dysfunction. And we're helping you out so that we can restore things and get your relationship back to normal if you're struggling with it right now. So let's talk about your treatment, because it's so different than the pill. If somebody's already taken the pill, you still need to listen, because this is very different.
It is so different. When you have ED, it can feel like you're hopeless a little bit. The pill may or may not work. It causes side effects in almost everybody. Maybe you've considered injections or other extreme, maybe surgery even. We have eliminated all of that out of the picture. When it comes to the acoustic wave therapy, this opens up the blood vessels. It increases blood flow. I've seen x-rays before and after of this part of the body. And it's amazing to see that it really does regrow blood vessels. What would that do to life in the bedroom? If you had more blood flow, that's what ED is. It's a lack of blood flow.
And what's crazy is it can do it after just one treatment. Yeah,
guys start to see the results really quickly. You come in for a few treatments over 2 to 3 weeks. That's typically the entire program. Think about that, guys. I mean, in the mid or late April, you could be done with these treatments, throw the pills away, not having to worry about pre-planning. The key word here, spontaneity. That's what couples want. They want the spontaneity.
Now tell me this, so 2 to 3 times, and then are you good to go? Like, do you have some people that never have to come back again, or do they have to eventually come back?
We do have guys that never have to come back again. We would retreat somebody for free if they ever needed it, but it's rare, and the studies suggest that this is a long-term solution. I don't know if I would use the word permanent, but long-term solution certainly.
Long-term, and you only have to go in 2 to 3 times, most likely.
You got it.
And for what, 8 to 10 minutes?
Yeah, 8 to 10 minutes. It's non-invasive. It's just placed on top of the skin. There's no recovery time. This isn't a painful or surgical process. It's not.
They don't even really feel.
Maybe a little flicking sensation. Some guys say it annoys them a little bit, but
for 8 to 10 minutes, you can handle it.
You can handle it, and the results are worth it.
Yes, 100%. I love hearing your success stories as well. You've had so many success stories, everything from people in their 20s on up to 90s. So if you're thinking, I'm too young, or I'm too old, or there's no hope, I've tried everything, think again.
That is true. We've treated thousands of men all over the country now with multiple clinics, some guys in their 20s, some guys in their 90s, up to 100 years old. So what's interesting is age really isn't a barrier to this. Also, diabetes, prostate issues, or any health history you have, you may be thinking, well, you know, I'm overweight, or whatever it is. We can treat you, we can reverse the ED, and you can see the results.
I love it. Let's talk about the technology and when it was invented and FDA approved, all that.
Yeah, so in the 50s, they were using this type of technology to break up kidney stones. That's called lithotripsy. It was developed from this. Maybe they found that this was a good side effect, like ED was being fixed. In 2011, this is an FDA-cleared technology, and so it's been developed since then. Tons of clinical studies. Cambridge has a study. Urology Times has a study. I was reading on PubMed, 86% success rate in eliminating erectile dysfunction.
Which is a huge, huge, huge success rate.
In the medical world, that is very high.
Oh, yeah. And it's so non-invasive. I mean, we're not talking surgery or anything, which is so nice. So start the conversation and offer your support as well. If you're thinking, you know what, as the partner, I don't necessarily want to be there and see this happening, you'd be surprised how many partners actually go with the person to the clinic, and they're there for their support and to talk about it and understand how it's going to work.
Yeah, you know, there's probably a lot of females watching, partners of a man that has erectile dysfunction. Communicate. Bring it up. I think it's a compliment to the relationship instead of maybe you think it might be an insult. So bring it up and get it handled. Absolutely.
100%, because it will be a compliment. So special offer, and how do they contact you?
Yes, call the number on your screen. We will do the initial assessment, medical exam. This is with a medical doctor. He'll do a blood flow ultrasound. That's a $300 value. We're going to do it free if you call us now.
Love it.
Also, get started on our treatments. We'll give you a special gift. I call it a booster. Yes, instant results in the bedroom, totally free.
I love it. Right, you're welcome. You're going to be thanking us later. Give him